Patients often ask me if their pregnancy is high risk, and for some people it seems to be really important to them whether they're being labeled high risk or not labeled high risk. To some extent it's really just a label and it doesn't really matter so much. And in fact, sometimes I'll tell patients, you relax, let me worry about your risk, you just enjoy your pregnancy. Because to a great extent, that's some of what you're paying me for, is to worry for you so that you can relax. However, there is some issues about whether or not you're high risk because it might affect who you choose to see for your obstetrician. In other words, there are choices out there. You could see a family doctor, a real obstetrician gynecologist, or even a midwife. And my opinion is that if you do have a high-risk pregnancy, you really should be seeing an obstetrician because they have the highest level of training to take care of your pregnancy. The truth is, almost anybody can take care of a low-risk pregnancy. It's recognizing the risk factors and seeing when someone becomes high risk and then knowing how to treat that really sets the obstetrician apart. So let's talk about some things that make you high risk. If you have any underlying medical problems like diabetes, high blood pressure, say you have chronic kidney disease or chronic liver disease, if you have HIV or any other chronic medical issue, that certainly puts you into a high risk category and it changes somewhat the way that we will follow your pregnancy. There are other things that make you high risk. One thing that's sort of relatively high risk is something we call advanced maternal age, which is sort of a nice way of saying that you're old for having a kid. Now, we in obstetrics are kind of sick what we call advanced maternal age because 35 makes you advanced maternal age. But the truth is, a 35-year-old who's pregnant is a pretty low-risk pregnancy. However, a 43-year-old that's pregnant, it's much higher risk. And so as your age gets farther and farther up, the risk goes up steadily. Not only is your risk of having a baby with a genetic problem go up, but it also increases your risk of other things. So your age can certainly increase your risk of pregnancy. So there are many things that can make you high risk. One of the things that may be done if you're high enough risk is that the obstetrician you're seeing may want to get consultation from what's called a perinatologist. In other words, may have you see a perinatologist as well as your regular OBGYN. Now, the perinatologist is somebody that went through OBGYN residency and then did an extra 3 years of training to learn about high-risk pregnancy specifically. And they have much more knowledge. They usually have very detailed ultrasound machines so that they can help your obstetrician with some specialized ultrasound equipment and also some specialized knowledge to help make your high-risk pregnancy as low risk as possible. So the idea is to make things as safe as possible. So that's one of the things that may happen when you have a high-risk pregnancy. So those are issues that kind of encompass high-risk pregnancies, but we will talk more about some of these individual issues as well.
Medtwice.com